Hey everybody, it's Ro. Welcome back to another episode of Mommy Virtue, brought to you by MetroHealth. Today we are talking about navigating healthcare for high-risk pregnancies. The MetroHealth Maternal-Fetal Medicine program is the longest standing training program for high-risk pregnancies in Cleveland. Whether you have existing health problems or concerns, or when you become pregnant or develop issues during your pregnancy, it's important to be seen by a maternal-fetal medicine provider for both a healthy pregnancy and baby. And in today's episode, we're going to be speaking with Dr. Kelly Gibson, OB-GYN, and the Division Director of Maternal-Fetal Medicine at MetroHealth, what women can expect if they have a high-risk pregnancy. So first, thank you so much for joining us. How are you today?
I'm good. Thank you for having me.
Good, thank you. All right, let's just jump right into it. High-risk pregnancy is just one of those subjects where people are like, wait a second, do I fall into that? What is that? What does that mean? So what qualifies a pregnancy as high risk? And are there any health conditions that contribute to a high-risk pregnancy?
Yeah. So a high-risk pregnancy, you can kind of define it if there's an issue with mom's health or if there's something that arises during the pregnancy with the baby's health. So for example, the most common things we see are moms who have a history of diabetes or high blood pressure or lupus. Those are some of the more common things we see. In terms of the babies, if there's twins or triplets, that would be a reason to come see us. If there's a concern maybe with the baby's heart or brain or something with the baby's anatomy, those would also be reasons to come and see us.
Okay.
Or if someone had a complication in a prior pregnancy, maybe a preterm birth or preeclampsia, those would also be reasons to see us.
Got you. Now, what about age? Like, what determines your age being high risk and why?
Yeah, so age is really a risk factor for a couple of different conditions in pregnancy, and it's really those conditions that would make you come to see us, not just your age.
Okay.
So being older puts you at a little higher risk for complications like diabetes of pregnancy or preeclampsia. So if you develop those, then I would want to see you.
Yeah.
You're also at a little higher risk for genetic issues for the baby, so things like Down syndrome. We do have screening for that.
Yeah.
So on that screening, if that came back as a high risk, then you would want to come and see us. If that came back as low risk, you wouldn't necessarily have to see us just for your age.
Okay, got you. How early in a pregnancy can these risks be detected?
So some risks could be detected fairly early in pregnancy. Like I talked about that genetic screening, that can actually be done as early as usually around 10 weeks of pregnancy, so still in the first trimester. Other things we can detect later in pregnancy, so something like diabetes of pregnancy. If you had it before pregnancy, we would know, but in pregnancy, usually we test at the beginning of the third trimester.
Understood. Diabetes. Now that's something that is familiar to a lot of people. Some women don't even get it until they become pregnant, and that is a gestational diabetes.
Correct.
So what exactly is that and how is it managed?
So diabetes in pregnancy really arises because of some of the hormonal changes and how your body processes sugar. And in some patients during pregnancy, it leads to their sugars being higher. Those higher sugars are then what we call gestational diabetes or diabetes from pregnancy. And those high sugars can affect the baby and the baby's growth and cause problems for delivery and are really important for us to be able to control during pregnancy. They also tell us that mom may have a risk for diabetes later in life, and so we want to treat her during the pregnancy as well as see her postpartum.
I love all this information because I feel like sometimes we have these like remarks made, or you hear about this stuff, right? And you're like, but what is that? And then you don't really, there's so much going on when a woman becomes pregnant or is going through pregnancy. And then to have like stuff like diabetes and you're just like, wait, what? So I love that if someone's watching right now and they're just like, okay, you know, we're just kind of warming them up and getting them prepared. It may never even apply to them, but still, it's just good to know, you know, just to kind of preeclampsia. What are the warning signs and how does it affect the pregnancy?
Yeah. So preeclampsia is probably the other most common complication that we see in pregnancy, and it's high blood pressures related to pregnancy. In terms of things we do to detect it, that's why we check your blood pressure at every visit, why we look for things like protein in your urine, because those are ways that we can diagnose it. You also may develop bad headaches, chest pain, or trouble breathing, or it may affect the baby's growth. So those are different things that we watch for during pregnancy. In terms of things a patient could watch for, certainly checking blood pressures at visits, coming in for regular care. But if you start having really bad headaches, chest pain, just feeling that something is off, listen to that and come in so that we can check you.
Good to know. I hope you guys are really paying attention because this is good stuff for real. Like, and it's scary, but it's good to know because again, it's kind of like prepares you. And then these are questions you can ask your doctor too.
Absolutely.
So before, does having one high-risk pregnancy increase the chances of you having another high-risk pregnancy if you become pregnant later?
That's a great question. So often it does increase the risk, but it doesn't mean you absolutely will. If, for example, you have diabetes before pregnancy, well, you'll probably have diabetes again and need to see me. But let's say you had gestational diabetes or preeclampsia, that may not happen again. And so you may not need to see me. We would have to screen you, but it doesn't necessarily mean you have to be a high-risk pregnancy.
Now, this is just a separate question. Is a C-section essentially like a high-risk thing, or can even if you had a C-section before, would that be considered high risk if you're pregnant again later?
Having a C-section in the past does not mean that you have a high-risk pregnancy this time. It would mean you'd have to have a discussion with your doctor or your midwife about what you wanted this delivery to look like, if you wanted another C-section or if you wanted to try for a vaginal delivery. So you could talk about that with your regular provider. You would not necessarily have to come and see me or my high-risk partner just for that history.
Okay, just was wondering.
Yeah, it's a good
question.
question.
And if you could tell us what sets MetroHealth apart from other hospitals in both recognizing and treating high-risk pregnancies?
Well, as you mentioned at the beginning, we have we have the longest training program for high-risk obstetrics. To become a high-risk obstetrician, we actually do 3 additional years of training. So we have the oldest program for that. We also have, we're the Center for Maternal-Fetal Medicine Research. It's actually an NIH grant at 14 centers across the country, and MetroHealth is one of those 14 centers. So not only do we have a whole team of high-risk subspecialists, we're actually doing the research to help us understand how to better care for patients during pregnancy right here. So we kind of have that cutting edge, hot off the presses research here in our program.
I love it. Well, listen, thank you so much. I really appreciate the information. Pregnancy, for some people, is like terrifying. They're like, what is about to happen to my body? What's going to happen to my baby? But then when you throw high-risk pregnancy in there, I can imagine how extra scary that sounds. So to have this conversation and be able to share your expertise and just, get the conversation starting so that you can have it with your doctor, I think is super important. Because hopefully it's not somebody's experience, but if it is, they have skilled, trained doctors who are willing and very helpful in your journey with your pregnancy, high risk or normal. So thank you so much, Kelly. I really appreciate it. MetroHealth cares for you and your pregnancy as a team. Their maternal-fetal medicine program is Cleveland's longest-standing training program for high-risk pregnancies. For more information or to make an appointment with a high-risk OB-GYN, visit metrohealth.org/OB-GYN or call 216-778-4444. Till next time.